Hello and welcome to the Answers for Cancers podcast. I am your host, Anne-Marie Fay.
And I'm Michelle Matthews.
Together with some of Ireland's leading experts, we want to unravel what it truly means to have cancer.
From consultant diagnosis to treatment plans, from managing your symptoms to supports available, we have it covered. So whether you're a nurse working in oncology or have been personally affected by cancer, this podcast is for you. The Answers for Cancers podcast is sponsored by Care Plus Pharmacy. Care Plus Pharmacy is Ireland's leading community pharmacy brand, offering expert advice and services for a healthier and happier you. Find your nearest Care Plus on www.careplus.ie or follow them on social media for health and wellness inspiration and tips.
Carmel O'Hara is a consultant psychotherapist who specialises in many different areas of psychotherapy. She is the facilitator of mindfulness-based stress reduction and mindfulness-based cognitive therapy, and she also facilitates the weekly drop-in and mindfulness sessions at Ark House Cancer Support. She joins us today to discuss exactly what is mindfulness and how we can incorporate it into our day-to-day lives. And she also talks about the benefits it may have for somebody with a cancer diagnosis. She also very kindly does a little practice session at the end to get a feel for what mindfulness actually looks like in practice. So stick around and we really hope you enjoy this episode.
So Carmel, welcome to the podcast and thank you so much for taking the time to speak to us today about mindfulness and particular mindfulness around cancer as well. We really appreciate it. If you don't mind, I might jump in with the first question. Could you tell us a little bit about yourself and your role here in Ark?
So thanks Anne-Marie and Michelle, and thanks for having me to be a part of your podcast series. I think it's a wonderful idea to get information out there for people who need it, so really appreciated being involved in this.
Thank you. Thank you.
So I'm a psychotherapist and a mindfulness teacher, and I've had the privilege of facilitating the drop-in mindfulness at Ark Cancer Support now for 4 years. And due to the pandemic, that we had to go online last year, and interestingly, since we've done that now, I've been facilitating the drop-in mindfulness on Zoom for the last 15 months, and this has proved to be really successful because what's happening is that people from all around the country can join, and also people who are in hospital maybe, I've noticed, have begun to join us, who may be having chemo or recovering from surgery. Some people are recovering from their home and may not have been able to have come in, and they've been tuning in as well. So it's just been fantastic. So many more people can join us. So more recently, I've been also running a 6 weeks mindfulness course called Cultivating Inner Resilience through Mindful Awareness in Recovery from Cancer for those who wish to deepen their practice. So that's pretty much about my role in Ark currently.
Wow. That's great, Carmel. And how did you become interested in mindfulness, and I suppose more particularly in the area of cancer care and mindfulness?
So it's a good question, and I think it's an important question to put my interest in this area into context. So many decades ago, I trained as a paediatric and general nurse. And then in furthering my career, I became a psychotherapist, and included in that was I also delivered seminars on a family systemic approach to illness and death and dying to nurses working in oncology and in palliative care. And I personally have been engaging in my own mindfulness practice on a daily basis for many years. I then began to become interested in being a mindfulness teacher. So in 2014, I participated in the 2-year master's programme in University College Dublin that has a particular focus on training in the use of mindfulness-based interventions in clinical settings. So because of my experiences professionally, I've always felt comfortable working in medical settings. So then the opportunity arose for me to facilitate the drop-in mindfulness group at Ark Cancer Support about 5 years ago, which has really been a privilege to facilitate. And I suppose on a personal note, I was also diagnosed unexpectedly with breast cancer in 2011. And as I had already been practicing mindfulness, I found the practice to be a significant inner resource to support me during my diagnosis. And I think that's also influenced my wanting to facilitate the 6 weeks course ongoing at Arc House for anyone who wants to deepen their practice, to cultivate that inner resilience that I feel that I was able to have during that time and ongoing. And of course that was alongside good medical support and family and peer support.
Brilliant. And thank you so much for sharing that with us, Carmel. I suppose, would you mind if we start with just explaining what is mindfulness?
Sure. So, firstly, mindfulness is an age-old practice in most Eastern and Western spiritual traditions. So, but one doesn't need to come from any faith tradition to practice mindfulness. Mindfulness has two aspects. One, as a way of stabilizing our attention in a meditative way, as our attention can often be all over the place, but also mindfulness can be cultivated as a way of life. So in terms of definitions, there are many definitions, but here's a couple. So the first one is mindfulness is a way of paying attention on purpose in the present moment without judgment. And this definition comes from a professor in medicine, Jon Kabat-Zinn, who founded the Mindfulness Stress Reduction Clinic at University Massachusetts Hospital and who pioneered the gold standard 8-week program known as Mindfulness-Based Stress Reduction, or MBSR, in 1976, which was originally pioneered to work with those with long-term illnesses and those who suffer from chronic pain. So it's really important to mention Jon Kabat-Zinn because I think without his innovative way of kind of distilling mindfulness programs, we probably wouldn't be running these amazing programs today. And this MBSR program, the 8-week program, is the core foundation of many other programs that have developed since that time, including programs in mindfulness for cancer care. Another different definition I like is from Rob Narn, and he's a South African mindfulness teacher who describes mindfulness as knowing what is happening when it's happening without preference. But there are also certain attitudes or states of mind that if someone is interested in cultivating a mindfulness practice, then they're also encouraged to weave these qualities into the practice. I can only briefly refer to some of them here. So I suppose in no order of preference, the first is, as Kabat-Zinn mentions, the quality of non-judgmental awareness towards our experience. Now, I think we all know our minds are busy judging scenarios that are playing out in our world on a daily basis. So this is quite a different practice to hold the intention to be non-judgmental toward our experience. Another attitudinal quality that we endeavour to cultivate when engaging in mindfulness practice is patience. When we begin to sit with the intention of being mindful toward whatever is arising in our field of awareness, our minds can very quickly become bored, or we experience a restlessness in our body, and it becomes challenging to stay in the present moment when we feel an urge to just get up and end the practice, especially if we're new to the practice. So the deliberate intention to cultivate patience can assist us with this restlessness. A third quality that is core to mindful awareness is bringing what is called a beginner's mind to the practice. So if we practice with a sense of, oh, I've done this before and it got me nowhere, or the last practice was boring, bet this one will be too, this attitude can close us off to this new experience in this moment, and we can lose the potential of the practice. And actually, radical enough as this may sound, if we do find we are bored, as is often the case, another foundation is to accept that this is the case right now. And what does it feel like to be bored, rather than react to it? And as you can imagine, this can be challenging for us, as we are used to thinking that if we're bored, we always have to do something about it. So finally, other core mindfulness qualities are holding an intention to bring kindness and compassion towards ourselves, and a willingness to be generous in giving ourselves the time to cultivate this practice. So oftentimes we can be hard on ourselves and feel we should be doing it better or we should be more mindful. This inner critic, many of us are familiar with, and just cultivating the sense of compassion towards our humanity, our common humanity, can ease this inner critical voice over time. As Kabat-Zinn often says, if we don't hold the intention to cultivate these qualities, then the practice is not mindfulness.
Mm-hmm. Thank you, Carol, for that. That was a really comprehensive explanation of what mindfulness is, so thanks for that. We might move a little bit further into the benefits of practicing mindfulness. So what are some of the benefits for practicing mindfulness, in particular for cancer patients?
So a diagnosis of cancer often comes as a shock for a person and their loved ones.
Yeah.
And time needs to be given to come to terms with the diagnosis. But it takes a while to be given all the information about one's cancer diagnosis, as tests have to be done, biopsies carried out, scans and more tests. And this is a very anxious period, and crucial to this time, I believe, is good medical support, of course, and also support from loved ones, friends, peers, family. Our nervous system, however, will be very activated at this time, causing one to go into what is called fight-flight mode. And this means a lot of stress hormones are being released. And so what's going on in our mind is a lot of what ifs and what if. So our minds can go from the diagnosis to the worst possible scenario we can imagine without any information being given to us yet. And without realizing it, we are living in our heads 100% of the time and actually not really here. We are lost in fear and anxiety. And it's what minds do. They try to work things out. And this is called the doing mind. We play out scenarios in our heads, and sometimes this can lead to a deep distress that can fuel our suffering even more. So the intention of mindful awareness is to become aware of our racing thoughts and to drop anchor, as it were, directly into our bodies, bringing attention literally, if we need to, just noticing our feet touching the ground, to notice the movement of our breath, to bring awareness to our senses of sound, touch, smell, taste. And this is directly, not through the mind. We're often experiencing ourselves through our mind, but actually this is about direct connection with the body and the senses and the breath. Our mind, believe it or not, is only one faculty of awareness, and an important one. But when we mostly live in our heads, we're not present. We're in the past or we're in the future, playing out scenarios. So with mindful awareness, you're not expected to be able to stop the mind from thinking, but in noticing our busy minds, and then by deliberately anchoring our attention directly into the body or the breath or the senses, by doing this, we're placing our attention on something else other than our thoughts. And this can help to calm and soothe our very tired and often exhausted minds. So the drop-in for mindfulness at our cancer support can be a good place to be guided to do this, as there is a facilitator, and you may not feel so alone, even in the virtual space, that there's others sharing the intention of the practice with you. And referring back to John Kabat-Zinn, who I mentioned earlier, he says that as long as you're breathing, there's more right with you than wrong with you. And I think especially with a cancer diagnosis, one can feel totally caught up in the part of the body that is unwell and forget about the other parts that are still perfectly healthy. Coming home to the body directly can allow someone to reclaim again a more balanced relationship with their body and their thoughts.
And you mentioned that you do the drop-in classes. Would you mind explaining, just for anybody who's thinking of coming to one, what do the drop-in classes look like?
Sure. So the class is aimed at those with a cancer diagnosis who are at various stages along the journey, and they're also aimed to welcome a close loved one. They're also welcome. Carers also need support.
Yeah.
So currently it's remote via Zoom, and we may well leave it like that, or we may embrace both, coming in to the centre and having it on Zoom, so that many more people can join us. So what you need, as long as it's remote, is you need an internet connection. and just being very pragmatic, and a smartphone, tablet maybe, or laptop or PC. So you need all of that, or one of those. Ideally you have privacy in a nice warm space for 45 minutes. And also maybe wearing comfortable clothing and maybe having a nice blanket, because when the body slows down we can get cold or whatever. You don't need to leave your camera on. The most important thing is you can hear me. You won't be invited to say anything or asked any question. It is literally just turning up after you've registered for the session. So there's no pressure to have to feel any particular way at the end of it. So there's that invitation I spoke about earlier, to drop into the present moment on purpose, as best as you can, without judgment, with the intention of bringing kindness and compassion to oneself, through tuning directly into the body, the movement of the breath, and doing the best one can to notice when one falls into the stream of the thinking mind, and to come back to the anchor point of the body. And this is not an easy practice, and it takes a while to cultivate it. I often read a mindful poem, and also say to people, if the time feels too long, you can get up and have a cup of tea. That's the beauty of zooming in from home, and rejoin the practice in a few minutes. Or indeed, if you feel that you're too anxious to sit down for that length of time or lie down, but you want to stay connected, you can walk around your room very gently and still listen to my guidance. Mindful movement can be very useful for kind of a busy or anxious mind. Another thing is, if you are sitting or lying down, you don't have to close your eyes if you don't want to. Because sometimes if people are very anxious, it's best not to close the eyes. If someone is very anxious, I invite them to give a bit more attention to their out-breath, as that is the breath that stimulates the nervous system to slow down. So nothing is forced or striving. Sometimes people report after the practice that they had no idea how busy their minds were or how tense their body is. And this is really great noticing. How can we do anything about it if we don't notice? Or even just noticing when our attention is strayed back into thinking. That's great noticing. Often we don't know we're living in our heads. So that practice can just really begin to bring us into that awareness. Thinking in of itself is not a negative thing. Thinking is really important. But it's when we dialogue with the thinking mind and we begin to obsess and ruminate and feel caught in a whirlwind of negativity, then we can feel very stressed. And that can lead to secondary problems like loss of sleep, poor appetite, being moody, and it can also challenge our healing potential due to lowering immunity because of all the stress hormones takes the toll on the body.
That's great, Carmel. Thanks for that explanation of the class. I think that really helps for people that are kind of contemplating if they want to join in the classes or not. I know I joined into one of the classes last week and I really enjoyed the class. In your class you do explain the mind being like an untrained puppy dog, which I really loved that analogy. Would I be right in thinking that mindfulness can help train that so-called puppy, or like you said, become aware of it?
So yes, I must say I love that idea too, of the image of the untamed mind being like a puppy dog running this way and that, and a kind but firm owner keeping it on a leash and generally and gently bringing it back when it is careering this way and that. And awareness is like that owner, and when we've noticed that our minds have wandered, then we can bring our attention back to an anchor point like the body or breath, or through the immediacy of the senses. Awareness is a human gift, and it's like a gatekeeper. And this gatekeeper awareness is kindly and gently and patiently supporting us to drop anchor in the present moment, so that we are protecting our minds, we're protecting our mental health from straying like that puppy dog into unnecessarily anxious places. Sometimes if someone is too stressed to sit still, like I said earlier around the drop-in, then taking a mindful walk where you deliberately and as best as you can place your awareness on your feet moving, touching the earth with each step, with no purpose to go anywhere, nothing to do, nowhere to go, just the act of walking and being present to the movement in the body. This can be a soothing experience. Or also doing some gentle yoga movements with this quality of mindful awareness is another way to practice. But the important thing is that it's not about fitness, it's not about striving, pushing or pulling. It's just really about coming into the direct sensation of the body. Or even using our senses, like sight, to look directly and take in the quality of light in our room or outside, or the colour of a flower. You know, often we pass nature and wildlife and we're not really seeing it, we're not really there. We're thinking about it, but we're often not present. Even just bringing a deliberate awareness to the sounds of nature, which is so beautiful this time of the year. And we know that these experiences can be very soothing. When we're caught up in the hamster wheel of the mind, we can often feel we've no control over what is happening to us, inside or outside of us. And when we feel our mind is out of control, so too we can feel like our emotions are also. And mindful awareness can assist us in feeling that we've more agency over our lives again.
I love that analogy about the puppy dog, and I, as two people who've recently got puppies,
it's a really good analogy to relate to.
Yeah, absolutely. Oftentimes, I suppose something we see, Carmel, is patients struggling to accept their diagnosis, and the idea of being fully present with that can be extremely daunting. What would be your advice for anybody who's maybe a bit hesitant to fully accept the present moment?
Yeah, it's a great question and a really important one, and I'm sure it's on the minds of many people listening. The present moment is often very challenging. Mm-hmm. And a diagnosis of cancer, it's fair to say, is a very unpleasant experience. And a person needs time to take this in, get all the information they can, and sometimes all anyone can do with a diagnosis like cancer is to cope as best they can. And initially, if it's unexpected, initially sometimes people cope by shutting down, not talking about it, railing against it, being fearful, crying, and all the very normal things that any of us would do when we hear challenging news. And people need to be given the space to do that. But at some point, the reality has to be managed. So yes, it's unpleasant, but we can change it. If there's a diagnosis there, there's a diagnosis there. And we resource what we can. Again, always good medical care and support from loved ones. As a way of supporting ourselves, however, ongoing, practicing mindfulness can support us to perhaps stop that puppy dog mind from careering way out of control. The diagnosis of cancer is a reality, so how can we take care of ourselves in it? And it's a really good question to ask ourselves, how can I best take care of myself at this time? And perhaps by cultivating mindful awareness, we may feel like things are less out of our control, and we can begin to take back some charge of how we are feeling. So some reflections from those who attend the drop-in or from the 6 weeks course are, I now take the time to be kind to myself, or I'm learning to use the breath for everyday stressors or when anxiety is present. And taking time to take a pause, people have said, helps them to attend to what is happening in the body without kind of falling into the kind of panic stream of thinking. Some also say that they began to realise that they never liked asking anyone for help, and they kind of challenged that in themselves. And now they're beginning to just do that, because when someone has a diagnosis of cancer, you know, the more we can engage with being able to receive support if it's been offered, the more comforting and connecting that feels. And so this mindful awareness can assist us in getting to know ourselves and our needs, and to listen to what we might need at this very difficult time, and to be kind to ourselves, to our hearts, to our mind, and to our bodies.
We'll get back to our conversation in just a moment. We wanted to take a minute to talk to you about gut health. Please don't let digestive problems affect your summer plans. As the temperatures rise and our lifestyles get so much busier, it's really, really important to take care of your gut health because this contributes to your overall health and wellness. You can pop into your local Care Plus pharmacy for expert advice on how to improve your digestive issues, and also check out the wide range of supplements and treatments on offer. Now back to our conversation. Just thinking back to the class that I attended last week, you also mentioned an attitude of gratitude. What exactly do you mean by this?
Yeah, so of course this doesn't mean about that you're grateful for having cancer. So let me be clear about that.
Yeah.
That's not the attitude of gratitude I'm referring about. Mm-hmm. But perhaps when the initial shock of the diagnosis has passed and we're receiving treatment, we sometimes can remain locked in fear and negative thinking. And this is really understandable. But what we know from research into the functioning of our nervous system, called neuroscience, is that our nervous system has a negativity bias in that it's hardwired to remain on high alert to danger. And this is from kind of eons back, where we were running from tigers and we really had to watch our back. And it's a very old part of our brain, and it's called the fight-flight system. And when we're in fight-flight, we can get locked into worst outcomes. It's that sense of, the glass will remain half empty. And life may feel only bleak. And in this space, we're not able to feel the connection of others. We can feel very alone. And we know this from research. When we're in fight-flight, it's kind of immediate survival. So we're not able to open into the experience of connection. And experiencing this over a prolonged period can deepen our despair and suffering and heighten our sense of isolation and helplessness. So going back to those qualities that mindful is imbued with, gratitude is another one that Jon Kabat-Zinn talks about. And research shows that if we train our attention towards perhaps one thing that we may be grateful for in the midst of being challenged, so that could be like a close friend leaving some food on our doorstep, or taking a moment to savour the taste of food, or being open to just enjoying a cuddle with our pet, our dog, our cat, or being open to a cuddle from a friend when we're allowed to when COVID is over, or from a loved one in our bubble. Really taking that in. And by deliberately taking moments to do this, even when it feels strange at the beginning. So nothing is forced. We don't have to feel that gratitude, but it's like inclining our attention towards gratitude. We will hopefully begin to notice that our willingness to savour these moments can begin to calm our nervous system and incline our intention to a more positive frame of mind. And this won't happen in a nanosecond, but this practice is one part of an overall invitation to open into the possibility that there must be something more than this suffering. And by being willing to open into moments of gratitude in our day, this can support us to become less stressed and more open. And by being willing to cultivate those qualities of kindness towards ourselves and acknowledging actually that life is difficult and really validating that even though life is difficult, that acknowledging that all others are also suffering also, that we're not alone. And that's not to minimize our suffering, but that there's a shared solidarity with others also. And I suppose that solidarity can be experienced in the drop-in, for example, even remotely. And we know that when we're less stressed, we're able to feel more compassion for others, as well as for ourselves, and we feel more connected. And relational connection, we are now learning more and more from neuroscience research, is really crucial to wellness. And feeling connected in our suffering is so much better than feeling alone. It's a better way to do suffering, if you like.
Absolutely. And I know you mentioned earlier that you're involved in running the 6 weeks course, Cultivating Inner Resilience Through Mindful Awareness in Recovery from Cancer. Do you mind telling us just a little bit more about this?
Sure. So Yeah, so the 6 weeks course is for those who are kind of out of the acute phase of cancer treatment because they need energy and not to be kind of needing to attend medical appointments and so on. So the invitation is to kind of make a commitment. And it's really for those who are interested in kind of deepening their mindfulness practice, or to check in with it, find out more about it, and to really kind of learn more about mindful awareness and mindful ways of living over this time. So the commitment is for 2 hours for 6 sessions, once weekly. But there's also home practice. The person needs to kind of have the space at home and the openness and the time to maybe practice very kind of consciously for about a half an hour every day. So the intention of that is that mindfulness gradually gets woven into being a way of life. So from the kind of formal meditative practice to kind of being a way of life. So it's intended to become more familiar, to invite us to become more familiar with habits of mind, our own habits of mind, to become curious about how we are in the world and to deepen our relationship with ourselves. We think we know ourselves, but we often don't. And this attitude of curiosity without judgment towards how we react to life can be very revealing. And we can learn much about ourselves and begin to let go of some of those habits through the practice, the habits that don't serve us well. So our intention to respond to life with some more inner resilience is really important, rather than reacting and firefighting in life. And this can really be a great support to kind of get back into healthy living again, because anyone who's had cancer knows what that phase is like, of kind of the intensity of medical care and the gaze on you for about a year, and then somehow the medical support rolls back, which is great. But then it's like, what's it like to go back to work and to make that transition? It can be kind of a scary time, a vulnerable time, and the practice can really support us also at this time, and connecting with others, because a lot of mindfulness practices are done in groups, and that's intentional so that we don't feel so alone, and we've solidarity with others who are challenged by similar things as we are. So living mindfully, I suppose, or the desire to live mindfully, is like practicing a musical instrument. So if you want to learn an instrument, you need to practice. So mindfulness is like that. You'll only continue the practice if you feel the benefits. And I just want to take the opportunity to say that I hope to run an 8-week course in autumn at ARC Cancer Support. And that was created by my colleague in England, Trish Bartley. And it's called Mindfulness-Based Cognitive Therapy for Cancer. And it's just, again, a deepening of the practice. And again, its source comes from the mindfulness-based stress reduction program that John Kabat-Zinn had pioneered, and some of his colleagues who converted it into mindfulness-based cognitive therapy for those who are experiencing anxiety or kind of with a history of depression, but they're not actively in a depression when they actually go for the course. It's to support them in recovery, but also for mindfulness in cancer recovery. The combination of the mindfulness-based cognitive therapy and the support for the cancer recovery seems to work very well in supporting people in healing in their lives. So you can find out more about any of those courses or the drop-in at linda@arccancersupport.ie.
Brilliant. And we'll put a link to that on our Instagram as well, so that people can see that.
Can see it. Yeah. Brilliant. Yeah, Carmel, thank you so much. I feel like I've as somebody done the MBSR, I feel like you've managed to conceptualize the whole idea of the 8 weeks, that everything I've learned in 30 minutes. And that's a really difficult thing to do. So thank you so much.
Thank you. Appreciate that. Thank you.
I know you've kindly offered to read a mindful poem and guide a little practice to finish off.
I'd be delighted.
Brilliant.
Okay, so I'll read a mindful poem, as I often do in the drop-in and also in the programmes. Mindful poetry is kind of, there's some wonderful poets out there that have such a deep mindful awareness and have contributed hugely to the mindfulness field. So one such poet is a woman called Rachel Halstead, and she lives in West Cork, and one of her poems is called Gift. Give yourself the gift of your attention. Catch the whirlwind rush and gently, calmly set it aside. Sit still and watch its flurries echo inside you. Stick with the stillness and find calm in your breath. And as the flurries dissipate, find the knot inside, whose tight curling, tense clinging is at the centre of it all. And sit, and still sit, and know that in time the knot will unfurl, release, and there will be space again. And space becomes your gift, encircles everything, slows the pace, and lets the light in. And so I'll just even for those listening, allowing those words to drop in where they will, and I'll just offer a short practice. And this practice is called coming to the breath with kindness, and it can often be used by anyone who may be feeling anxious, who may be waiting for test results, or just kind of in that not knowing space after a diagnosis and things feel out of control. And coming to the breath with kindness was shared by my colleague in England, Trish Bartley, who works a lot within the cancer field and mindfulness. So coming to the breath with kindness. So just really kind of wherever you are, you're just sitting or lying, or if you feel you want to stand, that's perfectly fine. And really just noticing where your attention is at the moment. So if your mind is very busy, just noticing that. We're not trying to push anything away. But maybe just as best as you can, just bringing your awareness down into the body, directly down into your body. So if you can feel your feet touching whatever you're touching, whatever they're touching, whether it's the ground or the heels on the bed, carpet on the floor, and really maybe just experiencing that connection. And maybe just noticing the parts of the chair or the bed your body may be touching. So just sensing the back of the legs and that contact with the surface they're resting against. Maybe just noticing the spine rising directly from the pelvis. Just sensing the weight of the pelvis on the chair, your bed. And just noticing the lower back, the middle back, the upper back. And just having a sense of maybe how you're holding or how we're holding our bodies at the moment, softening into the shoulders maybe if there's any unnecessary hunching. And then just maybe beginning to be aware of the sensations moving through the body. So we're not looking for anything in particular, just whatever's here. Heat, cold, contact with fabric on the skin, texture of fabric, soft, hard, neutral. And maybe just coming to rest on the breath. So if you're not challenged by your breathing at the moment and it feels safe to do that, maybe just noticing the movement of the in-breath, maybe at the belly and the lungs. And then that out-breath. So just allowing ourselves, if you like, to notice the body breathing. And if at this time you are someone who's having breathing difficulties, it may be wiser to rest your awareness and noticing your feet contacting the ground, or maybe if your eyes are opening, allowing them to gaze on the quality of light in your room, or to rest on something soothing in your area of visual field. So whatever is right for you at this time. But if you're comfortable with coming to the breath, just staying with the rhythm of your breathing, breathing in and breathing out. And then if there's a lot of anxiety around and you find it very difficult to keep that puppy dog mind kind of in check, it might be useful just to kind of, when you're breathing in, to breathe in and count for 4 seconds. And then That slight pause before we breathe out again. Breathing out, perhaps this time breathing out for 6 seconds, so that we can allow the nervous system to slow down that beating heart, and just allow the mind to rest a while. So breathing in maybe for that 4 seconds and breathing out for that 6 seconds. So the out breath is kind of like the aha breath, the letting go, the releasing breath. So nothing is forced or there's no striving, just gently engaging with the breath as best you can. And then no need to feel a certain way or force anything, but if you can have the intention of allowing or inviting the quality of kindness to be breathed in with the breath. So as we breathe in, just inviting the intention of kindness through the body, through every cell of the body. As we breathe in that quality of kindness, and then just breathing out that quality of kindness. And then, as best we can, just engaging with using the breath, if you like, as a vehicle to engage with that quality of kindness, moving through the body on the in-breath, being absorbed into every cell, every organ, every muscle, every bone of our body. And as I said, there's no need to feel that way. If you don't feel that way, you don't feel like engaging with that, that's totally fine. Just resting anchor on the breath or the body or the senses is enough. But for those who feel that they can connect with that intention of bringing kindness through the body, just using the breath as a vehicle, breathing in that kindness. And also that sense of connection with others, that when we breathe out, that we can visualize others that we would offer that breath of kindness to. And we take in that breath of kindness, and then we offer that breath of kindness out to others. Others we know, strangers, just other souls around the world. So that breathing in of kindness and breathing out. And doing this for as long as it feels right for you to do that. You can do a shortened version if you're in a waiting room. If you have some privacy and you feel disconnected from your body, you can also place a hand on the belly area. That can be kind of a sense of connecting with the breath moving in and out. And also maybe placing a hand at the upper chest. We know from self-compassion and mindful awareness that for some that this can be a soothing experience to make contact with our bodies. And again, if that doesn't feel right for you, that's totally okay. Just doing what you need to do to be as you are right now. So just grounding ourselves in the body and in the breath, that breath of kindness flowing through the body, breathing in and breathing out. So in another few moments I'll end the practice, and just to offer my gratitude of being given the opportunity to share this space with whoever is listening at this time. Thank you.
Thank you so much. That was amazing.
Thanks for listening to the Answers for Cancers podcast. Please share this podcast with anybody who you think it might help. Also, if you can like and subscribe, it lets people know we're here. You can alternatively contact us on Instagram at the @answersforcancers_podcast. And if you've any questions on anything that we discussed today, please email us at the answersforcancerspodcast@gmail.com, or you can DM us on Instagram.